Can distal pancreatectomy cause a pancreatic fistula? Imagine undergoing surgery to remove part of your pancreas, often because of pancreatic cancer or other pancreatic diseases. One common concern after this procedure is whether it can lead to a pancreatic fistula. The answer is yes, it can. A pancreatic fistula is an abnormal connection that forms between the pancreatic duct system and surrounding tissues, causing pancreatic fluid to leak into areas where it shouldn't be. This complication is quite common after distal pancreatectomy, which involves removing the body and tail of the pancreas. Studies show that pancreatic fistulas occur in about 3 to 26% of cases. The wide range depends on factors like the surgeon's technique, the patient's health, and how the complication is defined in different studies. Several key factors influence the risk of developing a pancreatic fistula after surgery. One important factor is where the pancreas is cut. If the transection is made at the body of the pancreas rather than the neck, the risk tends to be higher. This is because the shape of the pancreatic body makes it harder to close the cut securely, and there may be narrowing of the main pancreatic duct downstream. Another critical factor is whether the main pancreatic duct is properly tied off during surgery. Failing to identify and ligate, the duct increases the chance of leakage. Surgeons aim to carefully locate and securely tie the duct to prevent fluid from escaping. The texture of the pancreas also plays a role. A softer pancreas may be more prone to leaks, but research on this is mixed. Patients with a higher body mass index, which indicates more body fat, are also at increased risk. This might be due to the technical challenges during surgery or differences in tissue characteristics. Other factors like longer surgery times, more blood loss, and the need for blood transfusions can also raise the risk of a fistula forming. To help manage this risk, surgeons often use tools like the Distal Pancreatectomy Fistula Risk Score. This helps predict which patients are more likely to develop a fistula, so they can tailor their care accordingly. Techniques such as meticulous surgical technique, careful duct ligation, and sometimes precompressing the pancreas before cutting can help reduce the chances of leakage. Patients should be aware of this potential complication and be closely monitored after surgery. Early detection and management are essential to prevent serious issues like infections or abscesses. Every patient is different, and individual risk factors can vary, so discussing these concerns with a healthcare professional is always the best course of action. Remember, advances in surgical methods and careful planning continue to improve outcomes and reduce complications like pancreatic fistulas.